But this afternoon, we find out how to consolidate the gains and even achieve zero infections rate, if that's possible. Dr. Dacosta Boaji is Director of Health Promotion and leader of National Risk Communication and Social Mobilization Committee for Ghana's COVID-19 response team. He's joining us for more via Zoom. Hi, Doc. Thank you for your time. Good afternoon.
Good afternoon. How are you?
I'm not too bad. So let's look at what we're learning right now. A little over 300, almost 400 active cases. A lot of people have asked the question, how did we get here? You heard Dr. Amoisi say that we have changed our case definition. I mean, from the beginning, we've changed it, how the rigorousness that we attached to everything that we did about COVID in March has changed. How do you explain to people that these are not the reasons why we are having lower numbers, and it's not because we're taking care of ourselves?
Thank you. I think we should put it into perspective. You see, when we started, we had a strategy, and our strategy was the 3T approach, where we trace, we test, and treat. Now, the lesser the new cases, certainly the contacts will certainly reduce. Trust me, we continue to do the contact tracing. We've not stopped. We continue to do the testing. And we continue to give treatment to those who are sick. Ideally, one would have expected that even if people are arguing that we are not testing, then bear in mind, some of the infected persons were also symptomatic. So you would have expected that at least some people would be reporting to hospital very sick. That is also not happening. So I can say that our strategy has worked and it keeps working. Now, if you listen to the president carefully, he sounded a word of caution that we have to tread cautiously because of the behavior of the virus. By this, our weapon is to comply with the safety protocols so that we know that, I mean, obviously, if people are complying with the protocols, then we have a guarantee that certainly at least we can reduce the infection to zero. So the fact is, as a country, the strategies put in place by government has been working, and we certainly have to sustain this by making sure that the population also comply with the safety protocols. And that is our only weapon. I keep telling friends that our medicine is the safety protocol. So that is what we have to do. If you look at the strategies that we've put in place since the pandemic started, they've been, obviously, they were very strict, and we still continue to maintain some strict protocols. So that has actually helped.
Yeah,
and
I mean, there are times.
Has been one of the key things. Yeah.
There are times you go out there and you see people. I mean, I live in a place where right there at my junction, it's a pub. And anytime I get there, it's a completely overloaded pub with nobody wearing masks. Is it possible that because we are not testing and people are probably not reporting to health institutions, and so we are not getting exactly the figure? It perhaps a good thing that we're not getting sick because then, like Dr. Moisi said, we'll feel it in the hospitals. But going forward, what is government's strategy to consolidate these gains, so to speak, so that we don't go back to this second wave that we're seeing across Europe and in the United States of America?
I think our strategy should be education. And you see, education within the communities should be our guiding principle. It should be our core. It should be our collective effort to make sure that, you see, this is the time that, to me, we have to explain the things to the populace and give them the reasons why they have to be wearing the face mask, the reasons why they have to be washing their hands, the reasons why they have to be doing exercise and also eating our local food to boost our immune system.
Okay.
Now, let me say this.
Wrap it up for me.
A lot of factors.
Wrap it up for me with what you want people to take away from this conversation today, Doc.
Okay, so what I want Ghanaians to know is that the infection is still in the country. And if we want to get to zero COVID-19 cases, then citizens must comply with the safety protocols, i.e. wearing of the mask and washing of the hands. I think these are very important to support governments in its fight to reducing the infections to zero case.
Dr. Jose, very big thanks. I'm sure that in the course of the week, we'll probably get back to talk to you because elsewhere, the coronavirus is treating people really badly. Dr. Da Costa Abuaji is Director of Health Promotion, leader of the National Risk Communication and Social Mobilization Committee for Ghana's COVID-19 team.